Welcome to Rural Health Pulse. I'm Jim Kinnear, Chief Human Resources Officer at the Indiana Regional Medical Center. In this series, we focus on ideas and stories impacting the health of our region and explore the programs and initiatives designed to improve healthcare and wellness. This podcast is a collaborative effort of IRMC and Indiana University of Pennsylvania. In this episode, our topic is the establishment of a rural family medicine residency program at Indiana Regional Medical Center. After years of planning, the IRMC Family Practice Medical Residency Program welcomed its first cohort of 6 residents in July 2022. Today, our guest is Dr. Amanda Vaglia, the Residency Program Director. Welcome, Dr. Vaglia.
Thank you.
To get started, would you just give a brief introduction of yourself to our listeners?
I'm Dr. Amanda Vaglia, and I have been here in Indiana County practicing rural family medicine for about a decade and a half. And I am originally a country girl. I grew up in central Pennsylvania in a county called Juniata County in a little town called Honey Grove. I like to joke that it was a lot like Walnut Grove from the Little House on the Prairie series. And our family has lived here in the community for quite a number of years, and I've been practicing family medicine in a little town called Clymer, Pennsylvania. We are developing a rural family medicine residency here in the community, and my role has changed a bit from my outpatient family medicine practice to combined administrative and teaching position in addition to my usual clinical work.
Thank you, Dr. Vaglia. So, Dr. Vaglia, I'm curious, why did IRMC decide to establish a family medicine residency program?
So at IRMC, we're very blessed to have a forward-thinking leadership team, and the trends in the nation are looking toward having a decreased number of primary care physicians in the coming years. The trends are also moving toward there are going to be a large number of those experienced physicians who will be retiring in the next 10 to 15 years. And so looking forward, IRMC has recognized that trend and would like to develop a program where we are growing our own physicians. And because family medicine is such a versatile field, caring for everyone from newborn to geriatrics, including obstetrics, that group of physicians is the best poised to fill a lot of the gaps that will be present in our healthcare system, not only here in our county and in our state, but this is a national issue that all health systems will be dealing with.
For anyone that's not familiar with residency programs, could you clarify exactly what is a residency program?
That's quite a good question. You know, we spend a lot of time talking amongst ourselves, but the general population isn't always aware of the path that we take. And so typically physicians go to 4 years of undergraduate studies. Most physicians major in science topics, but you don't have to necessarily major in a science topic. You have to take the requisite courses in those science areas, but not necessarily a major. And then one goes to medical school. And in this nation, we have 2 degrees for medicine. We have the DO degree, osteopathic medicine, and we have the MD degree, which is allopathic medicine. And both of those schools are 4 years in length. And at that point, once one is finishing their 4 years of medical school, that's when one starts to decide about what specialty they want to go into. And during that 4th year of medical school is when people start to apply to residency programs. And that's where we are currently. We started our interview season for next year's class, our 2nd class, here at IRMC of residents. And those are 4th year medical students who are interviewing with us throughout this year, and will be in a match program in the spring. The residency match is in March, and I call it a magic 8 ball. Everyone makes a list. The programs make a list. The applicants make a list. And on match day, which is mid-March, we all receive a list of where the medical students have matched in which residency programs. And that happens not only in family medicine, but that's for all residency programs throughout the nation in all specialties.
Once someone becomes a resident and begins their residency program, what all does that residency training entail?
So that's an interesting question. You know, family medicine, our training program is a 3-year program. there are other programs that are different lengths of time. The residents who have matched here in IRMC will be with us for 3 years. And because it's family medicine, and as we talked about earlier, family medicine, we're sort of the jack of all trades as far as medicine is concerned. So our residents will train in all areas of the hospital. They'll train in the ER, they'll train in surgery, they'll train in psychiatry. They'll also train in our outpatient clinic. And that clinic is located in Marion Center. And that's a continuity clinic. So the residents spend a day or two each week seeing patients out in the outpatient office. And because those are their continuity patients, they will continue to see them throughout their 3 years here with us.
I think often when we think about medical education, the focus is on the technical aspects of education. It seems that the residency program here has taken a very holistic approach and philosophy. I was wondering if you could share a little bit more about that.
So our mission with our residency program at IRMC is really to serve our community. We really want to fill the needs, the rural healthcare disparities that exist in our area, and we want to get out into the community. We've done some needs assessments. We've done some outreach with multiple populations here in our area, and the residents all come in knowing that that's part of our program, and that's really what our goal is. We have been out and about in the community. We have had some outreach with our Amish neighbors. We have some outreach with some migrant farm workers. Additionally, we're developing a refugee healthcare program. And so we're very excited about those opportunities and those intercultural experiences that we can have right here in our own hometown.
I can imagine starting a new residency program as a big leap of faith and the challenge of if we build it, will they come? Can you share a little bit about your experience and the interest that there has been in the residency program?
Sure. We started this process in the fall of 2019. And being an independent hospital, we really have a lot more flexibility over how we serve the community. We can make decisions within our building, within our hospital board and our hospital leadership, and really just discuss what our needs are and go forward without a lot of red tape, without a lot of long processes that a lot of bigger administrations run into. And so we were blessed with a community that was supportive, and we moved forward. We started having meetings to develop the residency. We had to do 2 levels of accreditation through an organization called the ACGME, and we had to do institutional accreditation as well as program accreditation for our family medicine program. And so we had our first match season last year. We had our accreditation in the end of October and then started recruiting and interviewing in November. We had a wonderful experience and recruited our first 6 residents. This year we have our accreditation going into application season, and so we have started interviewing last week. We have at this time about 930 applicants for our 6 positions. And so those are applicants from across the nation and even around the world. And so it's been very exciting to see that level of interest in our community here at IRMC.
Yeah, that's really impressive to hear that much interest in the program. Given that interest, what would you say is the long-term vision for the residency program?
So here at IRMC, we really want to train a well-rounded physician. We want to train physicians who can go out and fill a lot of those different areas of need in our community. And so we want to have a robust training. We want our residents to train intensively in the ER and the ICU and on their surgery rotation. But we also want them to train in the outpatient setting. Our goal is to have a resident who can, in their practice, deliver babies and take care of newborns and take care of a whole family, from the newborn to the parents to the grandparents to the great-grandparents. And our approach to care is comprehensive family medicine, and that's looking at a whole family and taking care of them through their lifespan and through many experiences and different situations that all families go through.
Is there anything else that you feel would be important to share regarding the residency program?
I think one of the things to note is that we've pulled together a team from a lot of diverse backgrounds. We have residents from California, from New York, from Erie, from Texas, and from right here in our little Indiana, Pennsylvania. And we're really excited about how our team has come together and how they're working together and the leadership that they've provided. In addition to our residency program, we also have mentorship opportunities for local college and high school students. And we also have medical students, both third and fourth year medical students who rotate through our institution. And as part of that program, we have a mentorship family system that we have set up. And so the residents really hopped right into our system, and they became the leaders of the medical students, the undergraduates, and the high school students. Each of those has an attending physician also working with the team, but they've really taken on leadership roles. They've really bonded well. They've really been enthusiastic about reaching out to our community, and I've just been very impressed with the quality of our resident and their willingness to really incorporate into our community.
Thank you very much for sharing that. And I think what I heard there was, in addition to the residency program attracting individuals from across the country, there's also opportunities for local students who are interested in medical careers to get exposure to what the opportunities may be as well.
Yes, that's an interesting concept. You know, in the old days, everyone was trained in urban areas, and the idea was that we would then recruit folks out to the rural areas to practice. The newer model that we're looking at nationally is to start training more medical professionals in the rural areas. And studies show that historically folks will stay in those rural areas if they're trained in those rural areas. And so not only are we looking at training people in these rural areas, but also encouraging those who are from rural areas. The medical education system can be overwhelming, particularly for first-generation students, rural students, and so we really want to provide a level of mentorship to encourage those folks to proceed and to continue with their dream to become physicians.
Great. Thank you very much.
Thank you.
Rural residency programs are a way to address the shortage of providers by training resident physicians in rural communities. Resident physicians are trained to address the unique needs of the rural population and become embedded in the culture of the community. Rural Health Pulse is a collaborative effort of the Indiana Regional Medical Center, Indiana University of Pennsylvania, and the Indiana community. It is produced by Chris Korn from IUP's Division of University Advancement and recorded by the IUP Communications Media. I'm Jim Kinnear. Thank you for listening, and be sure to watch for future episodes of Rural Health Pulse.